wasn't that hard to click the switch because this is work we've already been on the ground doing all of this time. And so we're just glad, we're grateful that now we have allyship, that now we have people that want to understand it. The challenge to me is a continued disconnect between in our health safety net, between our hospital, which I'm on staff, between the local clinic systems, between all of these different entities. It's still a very disconnected, siloed effect. And the only way we're going to deal with this, which is what Dr. Taylor and I's article early on in this whole thing, was to create a true, functional coalition, take egos out of it, take power issue out of it, and really get to the crux of the matter, how we're going to save people's lives. I trained in California, in San Francisco General. You know, we were out in the community. We you know, it wasn't like the hospital was over here and then everything happened over there. It was a complete continuum of care. And so that's what we're trying to make happen. And we're ready to partner with everyone. The biggest challenge is the young people, that they've kind of given up hope. I call them the Obama babies. They kind of grew up in this world where everything was possible and it was great. And now their faces are being smashed open with the reality of how hard the world is, how scary this is, how uncertain their future is. One of our scholars did a survey of young people. Well, they were wearing their masks. They do believe it's real, but only at that point, 7% of them had been tested. And part of the challenge with pediatric numbers is under 18, you need a doctor's appointment. It's very hard to get the testing. And so our pediatric numbers are actually worse than what we already know, and they're pretty bad. We're at like over 700, 100,000 right now, which is really frightening. And so young people are just kind of in their own world. They gather information through social media. So I'm really pleased that we've gotten our young, you know, our intern team really work social media and try to get that messaging and try to create vignettes to make it real. And now that, unfortunately, the sad stories are coming out, it's starting to penetrate. Sure. Because they were the bridge, but they're also the essential workers. They're also the ones out there. And so this is part of our challenge.
It is. And thank you for sharing that. I wanted to kind of shift our conversation just a little bit to another really big area of need that kind of builds on what you're talking about. And I want to say hello to Sandra. Thank you for being with us and representing the food bank. You know, I wonder how many people really understand what a food bank is.
Yes,
and I'd love to start there, if you would.
Thank you. Good morning, everyone. It's wonderful to see everyone on the panel. Thank you to the Foundation for hosting this today. So a visual, I'm actually in the food bank today. This is our program center. And my heart wants to grab this laptop and walk out into our sorting room, which is chock full of volunteers right now, sorting tens of thousands of pounds of food. When you think of a food bank, think of a warehouse, a Sam's Club. That's the magnitude of a food bank, with racks to the ceiling full of food, fleets of trucks, our drivers on the road at 6 a.m. every day to over 200 agencies and program partners. So we will this year probably send out over 20 million pounds of food throughout this community and DeSoto County. That 21 million speaks to that incredible impact of COVID and what it's done to everybody on the panel, everybody who's listening. Every walk of life has been affected by COVID. And I know for me and for virtually everyone I know, this is like the year of the unthinkable.
You know, kind of thinking about unthinkable, you and I had a conversation not so long ago, and you shared a statistic with me that really still makes me, I just still can't believe it. Did you tell me that 45% of the people who are showing up at the food bank are coming for the first time to your distribution?
That's true, and that happened April and May when the economy collapsed. People were thrown into unemployment. They would walk into the business in the morning and be out of work that afternoon. It happened that quickly. So throngs of people came to the distributions, and yes, 45% of the people who came to our mobile distributions were new to a food bank, had never used our services at any point in their life. It was startling and so hurtful to see.
So tell us a little bit about, you know, this is obviously affecting people's lives. So we hear it all the time in terms of our rent assistance and a lot of different things that are going on. Food insecurity, that's big. We've got kids who are out of school who relied on their free and reduced lunch. We know that 50% of our 45 or whatever the number actually is of students enrolled in our public schools, 50% of them are on free and reduced lunch. What is this? I mean, what is this looking like? Tell us about the distribution network that you have. Tell us how families are accessing it. How we're making sure we get people who aren't as mobile as others, children, all the way up to our elderly population. Tell us a little bit about how it works.
So when I call like March 15 was COVID day, that just the world just shut down essentially. For us as a food bank, our supply chain crashed. We lost access to the donated food that we typically have. We had to change our system of distribution so that everything was drive-through. And I think we may all be accustomed to drive-through now, but in March and April, that was a complete revision of how we did our work. Our volunteers were furloughed completely. They're only now coming back. And what we found was, in that first 3 months of COVID, our distributions increased 100%. So it was such a transformation, had to happen quickly. And the drive-through, you mentioned how are people accessing the food. That's really the methodology right now. I think it probably is a challenge for people who don't have access to a vehicle. We do have walk-ups. We still have walk-ups happening, but everything had to change in order to reach these new families. One of the things that we've done, and I think Dr. Merritt might be familiar with this, is taking the new unemployment numbers, because those numbers skyrocketed, 30 million Americans out of work, unheard of, with one of the worst economies in the last quarter that we have ever seen on record. Taking those new unemployment data, couple that with the new SNAP data, and identified entirely new pockets of need in Sarasota County that we would never have known about or thought about without going through this analytical process. So we've identified 10 new zip codes, or 10 zip codes. Some have our services and some are new for us, where there are these highest rates of unemployment and SNAP application, to begin developing new distribution strategies in those areas. So it's changed all of our lives. It's changed the lives of the newly unemployed. It's just a shock in every sense of the word for all of us.
I think all of our guests have something in common, which is, I think, and I'll put myself in that category too. We're all kind of data geeks, but isn't that a good thing right now, right? We've got to be able to look at the data. We've got to be able to interpret it in terms of the here and now, and we can't wait. It's got to happen all the time. And I know, Sandra, that you guys have been really forward thinking in terms of some of the research projects that you've been looking at, thankfully, so that you're going to be able to act quickly. I just ask that you share a little bit about the work you do beyond, I mean, food is important. Obviously, we all need it, but you're doing some really unique things and going deep. And would you share with us a little bit about your DeSoto efforts, how those have evolved over the last couple of years?
So like everyone on this panel, being evidence-based and data-driven in what we did. And like everyone on this panel, I hope, and I know actually, to hear Dr. Merritt say, this is a public health issue. This is not a political issue. This is a public health issue. And you have to approach it with those classic public health strategies, which includes that having the evidence base for what you do next. So out in DeSoto County, what a difference from Sarasota County. And I think that's probably true for the entire state of Florida. I think of the coastline of Florida, all glittery and sparkly with twinkle lights. And in the middle of the state, it's black. It is dark. It is dark there. And that's in terms of the resources as well. DeSoto, one of the poorest counties we have in the state, we sit right next door to them. So we did a great deal of research in understanding the need in DeSoto County and realized that what was needed was a resource center. So we established the DeSoto County Food and Resource Center, food being the draw, that pulls people in, but the emphasis is on the resource center. So we have a number of outreach workers who live and work there, and a lot of agency partners who are coming in now, well, before COVID, coming in to provide the services that are so desperately needed in that community. So it is really a resource center where food gets people in the door. We triage what their needs are, help find those services for them in the community, and are reaching partners in Sarasota. It's so beautiful to see. Sarasota nonprofits are going out to provide services in DeSoto County. Yeah. So it's a kind of a new concept for food banking, and a transition in food banking to begin to look at what are the underlying causes of hunger. Feed the line, yes, but let's look at what causes people to be in that situation, to be food insecure and hungry.
So Sandra, I don't want to ignore today's paper and some exciting you have, and I want to make sure that everyone, you've got it right there. Can you briefly tell us what's going on? I know you've got a long way always to go, because this is not going away anytime soon, but to help you in your efforts, what would you like to just share so people know it?
Thank you for asking it. I brought the paper here because I was just reading the headlines and I thought, look at this, cases, deaths tick up. Economic fallout expected to linger. Restaurant in downtown Sarasota closes permanently. It's in the paper, what we all are experiencing and are here today to talk about. We are very fortunate and blessed that Joe and Mary Kay Hinson Family Fund, who have done so much around education. When you think about the Learning Academies, Alta Vista, that's a lot of Joe and Mary Kay Hinson. But they have given a substantial gift of $500,000 to help address the crisis. When they originally gave the funds, we were talking recovery. This was going to be a recovery campaign. And then these numbers just flashed, just skyrocketed. And we thought we aren't tone deaf. We really have to talk about the crisis isn't over. So their gift of $500,000 plus an anonymous donor from Community Foundation of Sarasota County allows us to offer a $600,000 match, all of which is to address economic fallout expected to linger, business closing, deaths tick up. So we're incredibly grateful for that opportunity. It's launched right now and probably will run through the end of the year. Thank you for asking.
Absolutely, and thanks for sharing. And I just want to say, Lisa has been chatting here and just talking about how grateful she is for all that the food bank does, and that she had some interns, it sounds like, who did some work and their data, and I'll have you kind of chime in here, Lisa, because somehow I deleted this chat.
Yeah, we were fortunate this summer. We had 12 of our MHI scholars, many of them new college students, and 2 were funded by the Florida Alliance for Health Equity Research Institute. And one did a project on Haitian access to care, and the other one did a project on food security issues, and found that 28% of the respondents for the first time had to access community resources, which is part of why that dashboard was so important. And I want to applaud the food bank because it truly has been a lifeline. People are desperate and starving. Okay, you don't have to go to a third world country, right here in America and in Florida, and children. And so we paired from the beginning, because we never shut down. Okay, we're right there in Newtown, and we paired the food distribution with the medication distribution, because these were essential services, with mass distribution, with handing out pulse oximeters to high need people with symptoms and getting information in people's hands so they could kind of know what to do and keep hope alive. Because I think we also, and I'm sure Dr. Teller would talk about this, we have to remember our history. We got through polio epidemic, pandemic. We have to keep people clear. Don't listen to all of this input. Okay, keep hope alive. And the food bank truly is hope, and we appreciate you and what you do, and we applaud you, and please keep sending them money, everybody.
Oh my goodness.
But we also want to talk about the earth boxes and the gardening initiatives that we kind of had started years ago, because our thing has been teaching people to go back. I mean, Florida's agricultural. People used to grow food, and grow and support themselves a lot with food. We need to reinstill those practices so people can help learn. You want to teach them how to fish, right?
So speaking of a lot of collaboration and positive things going on, I want to turn it over to Dr. Cameron Hodgins to hear a little bit about this amazing campus of caring that she has with Glasser Schoenbaum Center. And they do a lot of things. They do a lot of things through all the agencies that are housed there. Cameron, do you want to just give us a little bit of insight into what that looks like, and certainly include your Center Place Health that is located right there, and you're in a great location for many of the vulnerable populations that we're talking about today.
Well, thank you, Kirsten, and hello to my esteemed panelists. It's humbling to be in your presence, and thank you for all that you do for the community. And yeah, so the Glasser Schoenbaum Center, if you have not heard of us or know where we are on 17th Street, between Orange and 301. I always tell people we're behind the Hobnob, but we're on the south side of 17th Street. And so we're close to Dr. Merritt's work, and Sandra is one of our nonprofits that we welcome there on the campus every other Friday for a mobile food pantry distribution site. And those numbers are up right now. And those individuals are in our parking lot, lining up early in the morning on Fridays to receive their food. So thank you, Sandra, for the work that you're doing. So right now we do have 20 organizations. We have 14 buildings, and I have to be honest, the buildings are pretty quiet right now. It's 48,000 square feet of office space in those 14 buildings. And the building that's on the very far west side of our campus is Center Place Health. And they used to be the primary healthcare services of the health department. And about 3 years ago, were tasked with creating their own separate entity. So that's their name now, Center Place Health. On our campus is pediatric care, as well as OB services and some case management. And we have a wonderful pediatric dentistry clinic as well there. And we appreciate everything that Community Foundation has done to support those efforts. I want to kind of speak at two levels. The first is, I really believe in networks, and the networks in our community are, as you can imagine, and as you probably would love to hear, really strong right now. I've never seen anything quite like it. I've been in nonprofit management here for 12 years, and when I first came back, and I said came back, I'm a native of Sarasota, so it's really, I'm a proud local, and it's wonderful to be able to do the work that I do. I care deeply about the community. But when I came back, and the thing I heard from donors the most was, you guys all operate in silos. And I have to say, about 10 years ago, probably a little more than we do, way more than we do now. And I think over my career here, I've seen those silos and those walls really fall. And why? Partially, you know, the donors wanted that. I totally understand. But and I tell you, we are more effective, more efficient, and much more collaborative these days. But those two networks depend on two factors. Trust and value are really important in creating supportive networks. So what do I mean? We have to trust each other. We have to trust what we're doing, that we're going to say, we're going to do what we say we're going to do for our clients. And then there's the value is tied to education. So how well do we know what our partner agencies are doing? And on our campus, we've worked really hard to have each other learn about the other services of the organizations. I've been there a little bit of around 6 years. And when I first got to Glasser, I realized the people down the sidewalk from each other didn't know their names. They didn't know what they were doing, what they were there for, how their services would complement their clients, or if they were seeing Sally, maybe the agency down the road was seeing Sally's granddaughter and nobody knew that, you know? So I've really tried hard to build those collaborative relationships and encourage their partnership. And quite frankly, it was already there. It just needed a little love. And prior to COVID, what brings everybody together, and this is no surprise, is food. So we'd have a lot of organizations come together on the campus once a month to learn about each other over lunch. And that really worked well. How we have shifted in COVID is to have webinars. And I have to tell you what the nonprofits on the campus are talking about now. One silver lining here, they are actually having better show rates in addiction recovery. And I know Dr. Taylor is going to talk to this on Zoom than they were in person. So just taking away the idea of the commute to the office and the childcare that they may need to get arranged. And, you know, if the technology is there, it seems to be easier for the person to connect with the service from the comforts of their home.
And, you know, I'll just add to that, some of our guests may have been on our education webinar, but we're hearing that throughout the community in terms of the connections teachers are having to families, that the mental health therapists that are in the schools are having to families, because it really does make access so much easier. And we're all just a little more comfortable with this virtual environment. So that's a really good point, Cameron. Thank you for sharing that.
Sure. And the only other piece that I'd say I'm hearing a lot about from the nonprofits is just, we still feel like we don't know what we don't know in some respects. So while donors and foundations are reaching out to us and saying, what do you need? What do you need? And there's an extraordinary amount of money coming into the county right now from CARES dollars. Right. We're doing our best to articulate those needs, but we're also kind of building this plane as it's flying. And it's a new feeling for most of us. Most of us have been very secure in our mission. We know our budgets year after year. We sort of know what we want to do, new projects, new proposals, those things. But this is just such uncharted territory, as you can imagine. And as Sandra and Dr. Merritt have alluded to, that it really does feel like we're building the plane as we're flying, which is why those networks and the trust and value are so important with our community partners.
And Cameron, you also play a unique role within our Season of Sharing network. So I think most of our guests are familiar with that, but just, you know, broad strokes, this is a 20-year trusted network. This year we've raised $5.2 million to bring back into the community. We know those CARES dollars are coming really soon. You and I have been in a lot of conversations over what that's going to look like. Tell us what you guys are seeing with Season of Sharing, where those needs are really ticking up. I mean, they've always been there. It's increased, and how the network is kind of responding to that.
We are grateful that the Community Foundation raised that amount to $1,800 from $1,000 per person, per family that's applying for Seasons. But you know, it's kind of interesting, and I'd love for everybody on this call to think about this. We were already in an affordable housing crisis in our community prior to COVID. We already, that was our biggest request for Seasons, was rent payments. And now this is like putting fuel on a fire that already existed. And we were talking about it a lot, but if there was ever a time to actually do something about affordable housing in this community, it was yesterday. We really have got to get on this, because if I would think of one huge fallout from this, if I wasn't seeing the CARES money come down and hopefully going to provide an additional safety net, because Seasons can't do it all, I would be really concerned about a increasing homeless population very rapidly, especially when the rent moratorium is over. The governor just extended that the other day to the end of August. But for Seasons right now, our biggest request: rent, utilities, and childcare expenses.
So I think you raise a really good point in terms of an already, you know, this big issue that was just kind of burning already, and we're adding fuel to the fire. I think it's a perfect time to bring Dr. Taylor into this conversation, because it's no surprise to anybody that we're in this mental health crisis, and now it's absolutely exacerbated. So Dr. Taylor, tell us a little bit about your work, what you're doing, what you're seeing. And, you know, here we are in this system. We're trying to make it work. We're trying to adapt. What's got to change? How do we have to look at things differently? What are you seeing? And where are the pieces that we can really start changing and are going to change permanently?
Sure. Well, thank you, Kirsten, and thank you to everybody on the panel, because each of you play a role in what we understand and have for a long time about the structural determinants of health, which are not just at the point of contact where diagnosis is made, but if you have food insecurity, you have housing insecurity, you have job insecurity, you have a lack of access to treatment, then you have an individual who is not reaching their capacity and potential in this world. There was a mental health crisis before COVID. And
Right.
it's only been exacerbated by what I'd call the two pandemics, what COVID has done in terms of highlighting where the intersection of where when you don't have insurance, when you're a person of color, who we know people of color make up 70% of essential workers, where you may not have access to treatment, and the disproportionate number of Black and brown people who have died as a result of COVID, and those numbers continue to increase, plus the pandemic of racism in America, which is embedded at every structural level in this United States of America, which impacts the processes that exist, which impact if you don't have a car to drive up to a food bank, what happens, which impact
Or
if you
testing
don't
site.
have or testing center, or if you don't have an ID, all those factors, which thankfully it appears that due to the work of all the foundations, there has been a dent certainly made, but I am worried. I am worried because the people who I work with at Centerstone, and I'm a psychiatrist, I do outpatient psychiatry, I run the MAT program, which is a medication assistant therapy treatment program in Sarasota for individuals who are addicted to opiates and alcohol and other substances. I work with the comprehensive treatment court team, which works with out of Judge Quartermain's court, which we try to keep people from reoffending, which has been funded incredibly, and we've kept almost 65% of people from reoffending by the fact that we can provide them housing, provide them food, provide them mental health treatment and support. The people who are connected to programs are connected, but they are starting to falter because even they are starting to lose their housing and lose jobs. It's all those individuals who are not connected to any network who really concern me, and those are families and those are individuals. So I think we definitely are in uncharted territory. And as much as we hold on to people who are within our networks, we need to start looking out to see who we can connect to and who is not, does not have a resource, does not have someone to call, because it's concerning. For the first time in the past couple of weeks, certainly have had more suicides, more people who've relapsed and died. And it's a really thin line that's holding people. So
how do we do that, Dr. Taylor? How do we find the people that we don't know about? You know, that's a challenge. It's a challenge in our early child care. It's a challenge in all of our systems. What are thoughts that you have or all of us?
Well, I think it is education. It's connecting. It's looking around at who's not there, and even telling people who, you know, the peers. My work. I mean, I worked in New York for 25 years. Worked at Rikers, and I'm a huge proponent of peer education. Meaning you don't have to have any letters behind your name to do a job. So we need to educate people who are showing up at food banks to tell someone else. Educate people who are showing up, you know, for all the great work that Dr. Lisa has done to find somebody who's not there, to knock on those doors and to really welcome those individuals and give them resources. But yeah. I think, and what the main thing concerning me too is what's happening with our schools. We know that when our kids aren't at school, in terms of reports to Department of Children, Family and Services about abuse, that's down 30%, which is not a good thing. It just means we don't have eyes upon them. We know domestic violence has increased. So people are more and more isolated. And I agree. I mean, Centerstone, we turned around technology in a week to reach people, but there are still a number of individuals who we still are not able to reach. And we can't count on telemedicine. We just have to, I think, have a mentality that we have to leave no rock unturned and really try to connect with more people in our communities. But I applaud the donors. Thank you for what you've done. I applaud every single person on this panel, because the one thing we know about the brain is it needs nutrition. The brain is the first organ in our body to receive nutrients. We need sleep. So you need some place to lay your head down at night. You know, you need access to treatment. So, you know, like the World Health Organization says, there's no physical health without mental health. We're one body. And so, you know, we just need complete people so that they can have happy families and healthy families, and education is a key component. So.
Right. And we always say it's the whole child, the whole family, the whole community. So there's so many ripple effects. You recently said on a spot on Bay News 9, you said, we need all hands on deck. This is about a new humanity. Can you talk to us about what you meant when you said that?
Sure. What I mean is, you know, for the first time, we are challenging the myth of white supremacy, which is basically, you know, talking about white privilege in the sense of recognizing it, and it's not just Black people who have to talk about racism, prove racism, that everyone is looking at it, young people, multicultural, really trying to make a change, understanding that racism is a public health issue as well. And then Black Lives Matter, which doesn't mean that blue lives don't matter, doesn't mean all lives matter, but we're saying that we want and we need everybody to work at fighting inequality, fighting inequity, how we can make our communities healthier, how we can make our schools healthier and people healthier. Because when we have a robust economy and we have people working and not taking sick days and can go to work because they don't have to stay home and take care of their children and don't have a lack of sick days, then the whole nation can function better. So the new humanity is not about looking at the color of someone's skin. It's not about looking at their zip code, not about looking at, you know, what they're dressed in, but understand we are all people who need to connect. And, you know, as one person goes, so do I. And I think for most of us, that is really where we are. Helping someone doesn't take away from who we are as individuals. It makes everyone better. So the new humanity really is like working at shedding the old myths and ideas that we had and trying to reach up and reach out and lift everyone, which, you know, I'm speaking to the converted here because you don't know that, but we need more.
Let's unpack that a little bit as a group. So what does that mean for the human services model? What do we need to change and how do we begin to do that? And a hush falls over the crowd.
Well, I was just talking. I'll let somebody else speak.
Go ahead, Dr. Janet. Well, I think it starts with this. You know, when you look at South Africa, that emerged from an insanely separatist apartheid policy of enforced separation by racial divides, and they had a Truth and Reconciliation Commission. And within one generation, they merged from that system to a system that has 11 official languages and representation, and by the way, handled their COVID crisis with far fewer resources than we do. Had 68,000 community health workers on the ground taking care of their community because of the spirit of Ubuntu, which in South Africa means that I see you, you see me, we're all connected, we all must take care of one another. We need to reinstill that as a country. We need to begin to accept and recognize our past failings and pain and not keep trying to sweep it under rugs, because it keeps coming back to slap us in the face. And in doing that, not obsess on it, but recognize it, and therefore then focus on where the deficiencies are. Focus on why, you know, Blacks, Indigenous, people of color are always at the bottom of this wheel being crushed under, and stop blaming the victim and stop being complicit when you see implicit bias and active overt racist things and saying, wait, let's hold up, move this back. So starting this real kind of conversation and really looking and understanding these numbers, they're not made up, they're very real.
Right, right.
Stories.
And I would add, from a human services model, like it is about at the point of contact where we know we can capture people, that we can assess how their housing is, we can give them food, we can give them, you know, there's no reason in terms of from an integrated behavioral healthcare model, when someone is in my clinic, we need to have a nurse practitioner or someone like Dr. Lisa or an internist there who can handle their diabetes and their mental health and all of those things. So how do we get more services, point of contact, we can address all of their needs? And I think that is really speaking to a human services model, instead of having people have to go to point A to point B to this or that.
That sounds like
we need to capture them.
Care coordination,
that sounds like a great opportunity.
Yeah, that's what we do with our Safekeeper project.
Right.
Thank you for supporting that. And we're in our phase 3, which is where we have our assessments, getting information input from different people, business, whatever, where their needs are. The Safekeepers out giving, you know, with food on the ground at the places where people are, and then making referrals to the Links, which is an amazing group of ladies. We have a phone bank of 30 ladies who are then following up, encouraging people, helping to navigate. You know, people don't have phones. We have to write and try to get phones to people. We're putting Wi-Fi in places so people can go and use, you know, people are sitting in parking lots so their kids can try to do their homework because they don't have Wi-Fi. We have to stop making assumptions that everyone has what everyone else has and go to the very, very baseline and work up. But when you have peer-to-peer counseling, we did this with HIV, it's very powerful. People can hear each other, they'll listen. There's an issue of trust. We have to recognize the historical distrust of institutional processes. And we have to recognize that, you know, even God bless season of sharing, et cetera, whatever, which is wonderful, we still are not dealing with a very large undocumented population effectively.
That's right.
And they, you know, smoking doesn't stay in the smoking section.
I do want to look at Cameron and Sandra too, in terms of, sounds to me like we have a tremendous opportunity with Season of Sharing, which Cameron and I have been talking a little bit about. When Dr. Taylor, you say point of contact, we got to use every point of contact we have and make sure we're maximizing that. And we're looking at some networks and building that connectivity virtually as well. But Sandra, it makes me think of DeSoto. And I remember you telling me that you even had a benefit specialist there at one point. I don't know if that person is still there, but that's a point of contact that we could probably be better utilizing. I mean, there are some infrastructures out there. They're gonna look different, but it's all there. I don't know if you're on mute, so.
Talking away. I have 2 points I wanted to make, and one of them relates to that. We believe this particular food bank is really based on a public health model. So it is about community outreach. And we do have, out in DeSoto County, we have several, and the benefit specialist is one of them. And they are literally boots on the ground, door to door, helping people sign up for SNAP, Medicaid, whatever services they need. Now, as a result of COVID, here in Sarasota County, we will be, we'll have at least 4 to 6 outreach people boots on the ground in the neighborhoods, in those high risk, high need neighborhoods. Wonderful opportunity to share resources. This is door to door. They'll be going door to door. So a wonderful opportunity to share resources about what services are available and how to access those. Another point I wanted to make, and how human services can work together. There's a misunderstanding. I think we can use this opportunity to clarify that food insecurity and the issues related to food insecurity are directly tied to unemployment. That's the highest
and
indicator.
health insurance. Insurance
is unemployment, and not poverty, it's unemployment. So if our energies are on that, look how many people we can bring into the broader community. It's about unemployment. So when you are tracking unemployment, track food security, track health insurance related directly. That's a key factor for us as a community.
Absolutely. We have a question from one of our guests, and that is, if you're a donor looking to give between $1,000 and $5,000, where, we might find a couple different answers here, but where is the place where the most important place for these funds, and really looking at this particular person is saying, where are the holes in the safety net that need help?
I would say the homeless population. We are not dealing with them. We've paid all these consultants and we've had all these plans and we made all these suggestions. And Greg Cruz in Streets of Paradise, I would send that $1,000 to him right now. He's feeding 250 people a day. Okay. And so you can also look on the dashboard. There are a number of other community partners that are on the ground that don't have big fundraising campaigns and boards and things like this, but they are on the ground. Dollar Dynasty, Second Chance, Last Opportunity. I think that we need to do better at sharing the wealth with the people on the front lines that everyone takes advantage of to volunteer, and yet they themselves are functioning on the brink of disaster most of the time.
Okay.
We have to support those organizations.
I'll chime in. I am increasingly concerned about mental health for all populations. This week in particular, I've heard some really shocking stories that are really disconcerting. And so if you feel strongly about mental health care, please donate to an organization like Centerstone or Centerplace or First Step or any of these, even addiction recovery centers. It's getting there, folks. I mean, it's high time. And the isolation is just really, really, I'm a developmental psychologist by training, and I will never forget the Harlow monkey study, right? Where they put baby monkeys on towel moms and then chicken wire moms, right? And that isolation and that kind of the baby monkeys that were on the chicken wire forms were extremely mentally ill by the time they grew up. And not having just human touch is not something that we do well in at all.
And feeding on
I want to remind our guests that they can ask questions too, so feel free to type them in. Go ahead, Dr. Taylor.
I was going to say, feeding on that, certainly the attachment is so key, but I don't know specifically the organization, but my soft spot are for kids, and especially kids who are growing up in homes that we know 80% of women who have been in prison are mothers, you know, kids who have mentally ill, substance addicted parents, and school time is here. And so anything that we take for granted that parents can buy supplies for kids, now they're at home. So I'd say any program that really supports the education of our lower income children, because as you know, you said, Sandra and Lisa, education is the #1 predictor of healthcare outcome, and education also is a big predictor for employment, housing, and everything else. So, you know, do your homework and you know, find these organizations that are supporting what you believe in.
That's a really good point. And someone mentioned, so I'm going to go to this other question that came in, and that is, what advice would you have for someone who's ministering to prisoners and felons during the pandemic?
So I've worked with a lot of people who have been criminal justice involved, and I'd say the #1 thread for those individuals is trauma, male or female, physical abuse, sexual abuse. You'd be amazed the number of men and women who have suffered, and it leads to how their outward behavior, but does not speak to the character that they have. So when you're ministering to them, I would really focus on their strengths. And, you know, in terms of education, if they don't have a high school diploma, focus on GED. These are individuals who do not need you to give them things, but they need support and they need a chance. So getting a job makes a big difference, you know, getting an ID, which may be tracking down a birth certificate and funds to do that, but things that point to them really being gainfully re-entering into society in a way that continues to feed on their respect. So those kind of aspects.
That's good advice. We've talked a lot about this crisis, and it is truly a crisis. But I think we all, early on, Lisa, you pointed out that All Faiths Food Bank is a beacon of hope for us. And I know that each of you in your daily walks and the people that you talk to have seen some real silver linings and opportunities. And I'd like to make sure that we wrap things up on a note that we are in turbulent times. There is no doubt about that. But what is something positive or a success or a win or a moment that you've seen that really speaks to the resilience of our community? We know recovery, we don't know how long it's going to be, we're not even there, right? But we also know that Sarasota looks a little different than other communities in a lot of ways, some good, some bad. What is it that you're seeing that gives you a little more hope? And we'll start with you, Dr. Taylor.
So about 6 months ago, I saw a young woman who had a baby with her, and she was came in for opiates, but tested positive for meth and everything. Her daughter was 18 months old, dirty. They were living homeless. Anyway, I made a report to Department of Children Family Services, you know, told her. They came in and connected her with Spark. She got into treatment. She has a job now. She has now she has an apartment, and she has full-time daycare for her daughter. And the time after I made the call, you know, I had to see her again, and she came in 2 weeks later, and her first words were "thank you." And so that gives me hope, because I mean, the community organizations came together. She accepted the help. And now she's in a stable environment. More importantly, her daughter is. So when I think about, you know, for every 100 who don't end up like that, you know,
right?
Yeah. And it wasn't the thank you to me, but just the fact that she accepted it. So.
But it's one person at a time, and I think in times like that, you know, we got to look at it that way, one at a time. Sandra, how about you?
You know, it's really looking at this newspaper. It's very easy just to focus on the negative because it's all around us. It's just all around us. I think one of the first things that comes to my mind is the way this community has rallied to support each other. The kind of philanthropy and the kind of concern that we're seeing is beyond anything that we ever anticipated. On a very specific level, I've just written a note in the chat box that I would share with those who are on this webinar. I found out Monday about a new homeless camp out in DeSoto County. There were 5 working families there, new to that homeless camp, who had lost their jobs and then lost their homes. So that sent up alarms for all of us. We immediately got food out there. And I just want to tell you that DeSoto County embraced those families and have found homes and rent for apartments for them. And to see that in action happening in a matter of 4 and 5 days, since we found out, I think that is remarkable.
It is.
And when we talk about it's an individual, it's peer-to-peer, it's one-on-one, that's a perfect example of it. People embracing and wrapping around those 5 families.
Thank you for sharing that. How about you, Cameron?
I would agree with Sandra, just the pulling together of the community and the foundations, talking to each other with the county government, and we're all making sure what we're doing is complementary and supportive. I would say we were really good at that before, but just as humbling right now. And the giving challenge, the giving challenge in April, right? We were in major lockdown then, and I thought, oh boy, how's this going to go? And the community just came out in spades, and I remember almost crying that night, like just overwhelmed by the generosity of our community. So thank you.
Well, thank you for reminding us that is, we provided a platform, but my goodness, did the community respond in ways that I don't know that anyone's ever seen a giving challenge like that. So kudos to all of our nonprofits, all of you, our donors. That was masterful, really.
I think what gave me a lot of hope about it, more than the dollars, was people are paying attention. And I needed that hope, right? And I think my colleagues here too needed that hope. We needed to know that people are paying attention.
That's a great point. And Dr. Merritt, how about you?
I think I echo everything everyone said, which is wonderful. I love seeing all the multi-rainbow hued young people out getting their consciousness back and wanting to make their world better. But I want to share a story about a patient. I'm going to try not to tear up because, many COVID survivors of the 20% that end up in the hospital and the complications most of them require rehabilitative services. And we're still learning about this disease. And at the end of it all, it's really about this disease we're fighting, right? And I had the incredible honor of taking care of a number of them, of a lady who had spent 2 months in and out of hospital, ICU. She survived ECMO, which was this new treatment that we then found was working. And to witness her reunion with her husband for the first time, and to also see her be able to be discharged and work on that discharge and prepare her for that discharge, and to share with her, the hope that goes ahead even though she's still having problems. And this woman took my hand and prayed for me. To thank me, and I'm just thinking, I nearly broke on that one because, this COVID is so serious. And to think about people saying it's a joke, and to think about people, and then I'm dealing with it, I'm looking at the incredible power of the human spirit. And I want you to keep that woman's story in everybody's mind as we talk about this money, we talk about this fight, and we try to prevent it, because people are amazing. This disease is really amazing. I trained up in San Francisco at the height of the AIDS epidemic, and that was really bad at that time. But this is like nothing none of us have ever seen before in terms of what it's so willy-nilly. So just keep in mind that at Hope Springs Eternal, the power of the human beings, the people that are overcoming, surviving ARDS, surviving 3 weeks on ventilators, and getting back to their husband, their children, their family, and ever changed because of it. We have to keep this fight for them, and we have to protect those who have not yet succumbed to it. And it is possible if we follow basic public health principles. Wear your mask, wash your hands, stay home. We must impose our own stay at home now, because it's not being done by leadership, but that is our only hope in Florida to still this thing and to stop the surge that's happening. And I'm just going to say it straight up, and I'm going to say it clearly. That's our hope. Thank you.
Thank you. I want to just tell everybody how incredibly amazed I am that we're going to actually wrap this up on time, because I said this morning on another call, I could spend an hour with each of you. And I hope we'll get more opportunities to have these conversations, maybe smaller group conversations with people in the community about these issues, because I know that we're resilient and I know that we care, and I know that together we can come up with solutions that are going to be really impactful. So I thank each of you for taking time out to be with us. I know you prepared, I know you brought your hearts, and Lisa, the note that you ended with is just gonna make me teary, and too many people on this call know how teary I can get. So as we close, on behalf of the Community Foundation of Sarasota County, our board, our staff, our donors, thank you, each and every one of you on the panel for being here, and for our guests for being with us today. You've asked questions. I know that you've got lots of thoughts storming in your head, and I hope you'll share them with us in feedback that you'll get after this. And we want you to know that the Community Foundation appreciates all of you. Our nonprofit community appreciates all of you. And we just hope that we'll all go out and realize that it's just one person at a time. That's all it takes to make a difference. Thank you so much for being here. Wishing you a wonderful Wednesday.